everyone, once again welcome to my Oet channel. Today I came with another one Oet role play card. So this is actually somewhat tricky questions. Second degree talk, one thing, it is second degree talk. That means you are talking to the parent, not to the patient. Second one, they have given the daughter is not present. So something is there like a twisting way. Anyway, we will see how we have to present this role play card. You have to read carefully what they have given in the scenario. Like here, a parent of a 7-year-old girl. So that is the thing you have to underline, older girl. So this patient is baby girl who recently had a heavy nosebleed, would like some advice in case it happens again. So the parent came to you to get some advices regarding preventive care, or if it's happened, what are things they have to take care. And they have given daughter is not present. So that one also you have to underline, because this is actually setting is local clinic. The clinic setting or in the hospital setting, wherever, you have to see that baby is present or not. If the baby is not present and the setting is local clinic, no need to ask the baby's name. But if the scenario is in the hospital and the baby is not present in the conversation means you have to ask baby's name during 3-minute preparation time. Okay, because that is for the identification as a role of hospital policy. It's like a rules and regulations of hospital. So here this is a clinic and parent came to you to ask some questions regarding baby's concern. So no need to ask baby's name here. You can just ask as it is. We can start the introduction as it is. The first task is find out reason for parents visit. So you can start like this: good morning, wait for the answer. That means the greeting back. So parent also greeting it back. Then we can tell that my name is Rashmi Rajan, one of the registered nurses working in this local clinic. How may I address you and how can I help you? Then parent will tell that, good morning sister, my name is Johnson. I came here for my 7-year-old girl who recently had a heavy nosebleed. So I'm so much worried, me and my wife, we are so much worried and we don't know what we have to do if it happen again. And then, especially when you are talking to a parent, you have to be sympathetic way and you have to give more reassurance for them, even in the starting, in the middle of the conversation, and even the conclusion time. So we can tell, actually the next task is find out details about a child's nosebleed. Then we can tell that, oh Mr. Johnson, I'm so sorry to know about your baby's condition, but no need to worry, I'm here to help you with that. Then we can start the task. Before proceeding further, may I ask you some questions regarding your baby's nosebleed? So don't ask, can I ask you some question? Shall I ask you some question? These are all maximum you have to avoid during the role play. During the presentation, you can use may I proceed, may I ask you. Okay, these things and all, it will give you the more politeness. So you can ask, may I ask you some questions regarding your baby's nosebleed? Then parent is telling, yes, of course you can ask me. You have to ask regarding duration, treatment given, and explore relevant information about a child, like a previous occurrence, injuries to nose, general health, medications, etc. So how we can ask, okay, Mr. Johnson, could you please tell me how long the nosebleed was there, and have you tried any treatment? Then maybe the parent is telling that the nosebleed was there for 5 minutes, and actually I brought him to the nearby hospital, and we treated already. Or else maybe they will tell that it was there for 2 minutes and without any management suddenly it stopped. So whatever the parent answer, it's okay, fine. Then the next one, you want to ask some more questions. Then we can tell that, okay, I would like to ask you some more questions about your baby's previous occurrence, whether she had any. Here you have to be conscious. Baby is girl, okay, baby girl. Whether she had previous occurrence or any injuries have happened to her nose, and these two things we can ask togetherly. Then the answer will be no. This is the last one was the first time occurrence. It was occurred first time, and there is no injuries to her nose or head, something like that. Then we can ask that, and what about her general health? Whether she has any long-term health issues, or whether she is on any long-term medications. Then parents are answering that no, her general health is well and good, and she's not on any medications. And then we can give thanks for the information. We can tell like this: okay, Mr. Johnson, thank you for your informations. Then the next task we can go warn against leaning back. That means we have to instruct. Now we are going to give some advices. When you are giving advices, you have to take care, because this is second degree talk. You are talking to someone else, not to the patient directly. So always think about your recommendation paragraph of letter, how you will write. It is essential for her, it is essential for, it is advisable for her, it is suggestive for her, it is important for her. So that sentence construction should come here, same like our letter recommendation paragraph. So it is easy for you to explain, and you maximum you can avoid how to, you need to, you should, these things and all we can avoid if you are using this type of connectives. So we have to warn against leaning back, because it will increase the risk of choking. Then we can tell that I would like to give you some suggestions to prevent the complications, or I will explain you what are things you have to do if she have another 1 episodes of nosebleed. Here we can ask, may I proceed with that? Okay, then the first thing is that it is always advisable for her to avoid leaning back. Don't tell that you should avoid leaning back, or you should not tell that you should not you should not keep the baby leaning back because there is a chance of choking. No, you can always tell like this: it is advisable for her to avoid leaning back when she has nosebleed, because it will increase the risk of choking or aspiration. So it will lead to some more complications. Are you getting my point? That's enough. Then the next task is advise method to stop nosebleed. Leaning forward, pinching above nostrils, apply ice pack. Then we can tell that Mr. Johnson, when she will have this nosebleed again, no need to become panic. You can ask her to lean forward. At the same time, you can pinch her nostrils, pinch above the nostrils, or else you can give ice pack over the nose. So over the nostrils. So this everything will it will make easy for her to stop the bleeding. So how does that sound? You can ask, because we have explained 2 or 3 recommendations. So as an answer, the parent may answer you, okay sister, I can do that. These are all simple methods, so I can try for that. Then we can tell that I am appreciating your willingness to follow my advice. The next task is explain when medical attention needed. Longer than 15 minutes and excessive blood loss, nosebleed following trauma, persistent nosebleeds. Give information about nosebleeds in children. It's common in 50% of children of 6 to 15 years, mostly by picking or blowing, nose too hard, dryness in nose, etc. So we have more topics to explain in the same task. So you can tell that, well, Mr. Johnson, I would like to tell you that whenever her nosebleed is longer than 15 minutes, or whether she has excessive blood loss, or where if she has any trauma followed by this nosebleed, if there is any persisting nosebleed in such scenarios, in such situations, please try to get her to the hospital as much as early as possible, because in these situations, what are things I advised earlier, it will not work out. So please try to get her hospital without any delay. So are you getting my point? Like that we can ask. Then another information, and in addition, I would like to give you some more information regarding nosebleeds in children. May I explain you, or are you okay to hear about that? Like that we can ask. Then we can tell that actually these nosebleeds are common in 50% of children in the age of 6 to 15 years. Because mostly maybe they will blow their nose too hard, or maybe there will be extreme dryness in the nose, or sometimes the tiny blood vessels inside the nostrils will break and bleeding can occur. So these scenarios and all very common among this baby in this age group, and we can manage very easily with the recommendations what I explained to you before. So no need to worry about your baby's condition, but please take care of your baby if there is any injury and there is nosebleed, or if there is any excessive bleeding, as I informed you earlier. If something is suspicious that you could not manage, and if a baby is showing any other signs and symptoms, means of course she is in need of medical advice. So at that time you can get her back to the hospital, or else you can we can manage well this nosebleed at home. So is it clear for you? Like that we can ask. And our next task is suggest saline nasal spray. This is reduction in dryness, irritation and soreness. Then we can ask, do you have any concern? Then parent may ask you that so far now, is there any treatment, sister, to avoid or to prevent these nosebleeds and all? Then we can tell that your questions are very really reasonable, Mr. Johnson. I can see that you are more anxious about your baby, but no need to worry. We can suggest a saline nasal spray. Actually, this is over-the-counter medication which is available in medical pharmacy even without prescription, and it will be it will help your baby to relieve the dryness, irritation, or if there is any soreness. If the bleeding is because of this dryness or soreness means, of course, this nasal spray will help your baby. So you can get it from medical pharmacy even without prescription. So are you okay with that? Like that we can ask. So the parent is telling that, yes sister, it's fine, I can get it from medical pharmacy and I will use it for my baby. Then we can ask again, Mr. Johnson, I hope I have clarified all your doubts. I am reassuring you that if you follow all my advices, of course your baby your baby's nosebleed, if it's happened also, it can be prevented. And if you are using this nasal spray for her, of course we can prevent further nasal bleed also. Do you have any more concern to ask with me? Then parent is telling that, no sister, I don't have any other concern, thank you so much for your informations. Like that means we can wind up. Okay, Mr. Johnson, have a nice day. I'm once again reassuring you that nothing will happen for your baby. Whenever if you need anything, please do not hesitate to contact with us. Here is our contact number. Thank you so much. So with that we can conclude the role play. So here always when you are explaining the advices, take care, it is advisable for her, it is essential for her. Please try to do like this. So this is the advice, we are giving advice, but it should not be a demanding one. Okay, you should avoid, like that we could not tell. It is advisable for her to avoid. So this meaning is same, but one is demanding and one is in a polite manner. So you have to learn how to present the role play cards in a polite manner. Somebody's voice, you can see that somebody's voice, it will be hard as in nature. They could not change the modulation. If you are telling, no need to worry, this is different, no need to worry, this is different, but meaning and words are same. So the politeness, it is really very hard to make for someone, not for everyone, but for someone. For such students, I hope if you practice in such way, it will be easy. At least if you can use these words, it will give you the politeness. I mean, the way of politeness, your talk will be like a polite manner, even if your tone is not with the desired modulation. So I hope this role play presentation is useful for you. We will see with another one role play card very soon. Until then, bye, take care.